Hi, I am Dr. Beth Schrope. I'm a surgeon at Columbia University Medical Center. I specialize in the surgical treatment of a disease called chronic pancreatitis. And today, I am going to ask ChatGPT a question about one of our exclusive treatments, shall we say, for chronic pancreatitis, which is total pancreatectomy, removal of the whole pancreas, but with autologous islet cell transplantation. So let's go. Which patients with pancreatitis would benefit from TPIAT, total pancreatectomy with autologous islet cell transplantation? So what we got is an interesting answer. Certainly reviews the procedure a little bit. Again, removing the whole pancreas is the goal of this procedure, to relieve the pain of chronic pancreatitis. Adding in the islet cell transplantation potentially will avoid otherwise inevitable diabetes. It is true that the best candidates for this are those who have intractable pain, or really we wouldn't consider anybody who isn't having pain to have their whole pancreas taken out. So I agree with our ChatGPT that people who have severe debilitating pain, or who are in and out of the hospital, or who are taking opiates frequently, we should think about a surgical procedure for chronic pancreatitis if they failed other procedures. So there are some endoscopic procedures perhaps that could help them before we do an extreme thing like this. Some of the best, or shall I say, some of the best results from this procedure are in patients who do have hereditary or genetic pancreatitis, gene mutations in PRSS1, SPINK1, CFTR, CTRC. These are all hereditary or genetic forms of chronic pancreatitis, and historically they do very, very well with total pancreatectomy. I think what this answer lacks, what maybe I was driving for and I didn't ask the right question perhaps, is that there are other surgical, maybe lesser surgical procedures for certain patients. We don't have to take everybody's pancreas out because they have chronic pain, chronic pancreatitis, meaning there may be a target inflammatory mass, but I don't have to take the whole pancreas. I just take that piece. Or in some patients who have chronic pancreatitis, because of the fibrosis and scarring of certain parts of the pancreatic duct, the tube that carries pancreatic juices to the intestine for digestion, sometimes it gets very scarred near the outlet and it's very dilated behind it. So patients like that, I don't want to take any of their pancreas out. They get to keep it, but I want to reroute that duct, kind of going backwards into a piece of intestine. That's called a Pusteau procedure. So I think that ChatGPT did okay. Maybe my question was a little vague for them. I really wanted to say who, in patients that have chronic pain with chronic pancreatitis, who have failed endoscopic medical management, which surgery should they have, or which ones really should be thinking about getting their whole pancreas out as opposed to something else. So again, just with the caveat that maybe my question wasn't really awesome, I would give this answer a 5 because I really wanted to know more about like which patients should get this particular operation, because there are a lot of alternatives. We shouldn't necessarily just fall back on one type of surgery.